Good afternoon, everybody. Myself, Kaumudi from Bharat CXO. We have with us Mr. Mohit Agarwal. Good afternoon, sir.
Good afternoon.
So, how is the event? How are you liking it?
So I think it's a wonderful opportunity for everyone to come together and network. What I'm liking about the event is all the delegates, right? So typically we bring delegate from the pharma company, but I'm seeing this time the focus is more bringing delegate from the hospitals, right? So which is basically you're trying to capture the nerve of the space where we focus more, because I represent the pharma company and every time we go to doctors or the healthcare professionals, so I think it is good in a sense that you're really hearing from the horse's mouth.
Right, sir. Also, to what extent is healthcare important in this country? What do you think?
So I think it's a bread and butter. I would say it is the backbone, and typically you would see that in countries like India, we spend roughly around, I think, 4 to 5% of our total GDP on the healthcare. We have seen a lot after Ayushman Bharat, but there is still a need in terms of the data integration, in terms of the data digitization and digitalization. So to answer your question, it is very important because it is related to the health, life, and the overall well-being of every individual. And we have seen a lot of things happening post-COVID. So you'll see that as an individual, people, what they were spending on healthcare was maybe 10%. Today, people are taking, they going on fitness track. They're spending more on their healthcare. They're spending more on supplements to ensure that overall well-being is maintained. Because what people have realized after COVID is that it is not that your health or you become fit in just one day, right? It's more like the Rome is not built in one day. So that way I think the people have become very vigilant, and I'm seeing that a lot of spending happening towards the healthcare.
Okay, so you think the mere reason for this is COVID, because of the COVID?
See, the COVID was maybe a trigger, right? That created more vigilance or the awareness among people, and that's how we've seen that it has become more like we talk about public and private partnership, right? So post COVID, people have become vigilant in a way that they have to spend money, they have to prioritize their health. So a lot of time you will see in last 4-5 years there has been also discussion around the mental health, because COVID, literally when people were at home, right, people realized the need that they need to also work on their mental health. People also need to work on their fitness. People also need to work on their immunity, right? So overall, I think it was an alarm that everyone was missing, and I mean, I will miss my words saying that, but all I can say is that it was a blessing in disguise for people to learn and act upon.
Okay, lovely. Next, I would like to ask you that to what extent, like urban areas, we can talk about digital healthcare. So, how do you think is the rural areas are working on?
So I think it's a great question in terms of the rural penetration. But what I've seen is that with the way there were times when we didn't have the electricity. Now we've got the electricity, I think, across all the villages. Now I'm seeing that the infra, the with Jio and some telecom companies giving the free data, right? So that penetration is also happening. So these 2-3 things since have happened. There is also a lot of these companies who are running the online courses, right? So people are also becoming vigilant about that. Now what I also see is that in colleges and school, right, be it urban, be it rural, I mean, I learned pretty at a later stage about what AI/ML is, right? I think in last 3-4 years there is a boom around AI/ML, but now what I see is that some of these tools and technologies are being taught even at a school level, right? So I think, to answer your question, I think there is a long way, when we say that, okay, the rural markets are matured enough, but there is a penetration, and kids as well as the children are becoming more and more vigilant that they need to make this as a regular habit of being dive into the ocean of the digitization.
Okay, so we talked about rise of healthcare because of COVID. We talked about AI because of we can say COVID or lockdown period. So do you think these two things go hand in hand, like the healthcare and AI? How do they go hand in hand?
See, the healthcare and AI, I mean, some of us would say the AI is still new, right? But I would say that AI is not now new. It has become more like what computer or laptops are to everyone. In manufacturing, right, the AI is used to a greater extent. It is getting used greater extent into the data digitization and the data analytics, right? So they are hand to hand. And I think today, if I were to say that whether we can differentiate between healthcare and say that okay, I don't need an AI, it's not a case, right? You need both of them in tandem in order to improvise the overall infrastructure, overall services, overall, you know, the care for patients and the payers.
Right, right. So in the future, people will be skeptical about healthcare and AI, or will they accept it?
I think there's going to be a demarcation in a way that how do you define the skepticism, right? If I were to say about the cybersecurity or the data theft and the, you know, the data leakages, then yes, people will become skeptical, because many times it happens that you build a repository and there are cyber attacks, and you would have seen 2 years back that the data for a lot of these companies and hospital was leaked, right? There were cyber attacks, right? So that way, yes, people will be skeptical. However, there is no way that you can be away from the digitization, right? It is something that somebody is saying that, you know, you are going to school, or, you know, but you will miss the education, right? So there are very limited choices that you have, and the sooner people accept it, the better it is. I think there needs to be more collaboration in a way that you know, everyone embrace that. I'm seeing a lot of those changes after Ayushman Bharat. I think the way the data records are getting captured, right? We talk about the ABHA, right? So I think that way these are positive signs, and in years to come we will see that data democratization will take us to the next level, where you just get into the hospital, right, without carrying pen and paper, and actually doctor knows about your history and you can get the better prescription, right? So you don't need to remember anything. You the analysis is also coming up, you know, before the SCP, because today if you see, I think we've got only 3 to 4 SCPs per 10,000 patients, right, which is very low if you look at some of those Western market. Now if I were to demarcate this, and if I were to say that how AI would help, I think this will be a greater advantage to the SCP and to the patient itself if the data sharing becomes you know, viable for everyone.
Okay, that's quite interesting, sir. To conclude this interview, I would like to ask you, what suggestion would you like to give to the youth who wants to get into healthcare sector?
See, I think first it is said that the sooner you start, the better it is, right? So the same way I would say that we all have our different aspirations, right? So some of us would want to become the IS officers, some of us would become the, you know, the IITians, right? Some of us would like to go in NASA and all, right, in the aerospace. But every individual who is born represents the health, right, and the well-being, right? So you can't ignore that. My advice to them would be that you become cognizant of the fact that what you are eating, how you are eating, and what time are you eating. We all fall sick. I don't know that when was the last time you felt sick, and do you remember the medicine you took, right, apart from, you know, Dolo and paracetamol. So I think the small step that okay, what medicine is being given to you, you should know what salt it is. The more you know about the salt, the more you know about the molecule, you know, will help that what is working on your body. All right. And then of course with the, I think the kids are smarter today. All right. I mean, if I were to see, sometimes I feel that they are 10 times or 20 times smarter than what I used to be. All right. So I think the technology itself will take place, and they will continue to come up to speed. So I think my advice would be that yes, they need to be vigilant. They need to know, rather than just being blindfolded to what being given to them. So yeah, that's my advice to everyone.
Excellent. Thank you. It was a lovely conversation with you.
Thank you so much, and thank you so much guys for capturing these bites. Really appreciate that you guys flew all the way to Bangalore for this. Take care.
Thank you, sir.